Good afternoon, and thank you for joining us for this afternoon's virtual media briefing about COVID-19 in London and Middlesex County. We're glad that you could be with us. We're also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. A welcome to the media this afternoon who are joining us, and a quick reminder, if you do have questions, as several of you already have submitted, but if you have not yet submitted your question, please do so by clicking on the question icon here on Microsoft Teams. And when you submit your question, if you could indicate your name and your media outlet, as well as who your question is directed to. We'd also like to say good afternoon to the folks who are joining us on Rogers Television, as well as the Rogers Facebook page, YouTube channel. Those who are listening on Global News Radio, AM 980 CFPL, and the folks who are tuning in on the CTV London website. Before we get to the opening remarks, I do want to mention something. I have put on the live event Q&A a link to the province's COVID-19 guidance for prioritizing healthcare workers for COVID-19 vaccination. You would have received the media release that went out earlier this afternoon from Beth Milne, and that link will help you to see the full prioritization document. So with that in mind, we will begin with our opening remarks, and we'll start this afternoon with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. You know, despite the blinding white snow everywhere you look today, the color on most people's minds, including my own, is red. After more than a month and a half of lockdown, restrictions in London Middlesex have loosened today as we enter the red category of the Ontario government's COVID color tiers. Among other things, it means thousands of businesses across our region, closed since the province-wide lockdown on Boxing Day, are finally allowed to reopen their doors. Despite that, we know a number of sectors, most notably bars and restaurants, local gyms, recreational activities, and others, continue to be severely impacted by these ongoing restrictions. As I said earlier today at my State of the City address, my heart goes out to these businesses and their employees. Since the onset of the pandemic, business has done everything that's been asked of them, often on short notice and at significant expense, while constantly adapting to ensure members of the public are kept safe from COVID-19. According to the available data, businesses are not responsible for the level of spread we've experienced, but it is they and their staff who wind up bearing the brunt of the consequences. These businesses have done everything that's been asked of them, often on short notice and at significant expense. So, the best way we can help those businesses while ensuring our own personal health and well-being is to remain committed to following all public health guidelines as consistently as we've been over the last several weeks. You know, it was just over a month ago, our daily case counts were close to 200. We've dropped since, to the low teens, followed by 8 yesterday and 5 today. If we keep that up, we'll continue to save lives. And provincial authorities may have no choice but to move us into a more relaxed tier of restrictions in a couple of weeks' time. That's if we've earned the right. That remains the focus right now, and I hope it is the focus of all residents of London and Middlesex County. Thank you so much, and over to you, Dr. Mackie, please.
Thanks very much, Mr. Mayor. And let me also say a sincere thank you for your speech this morning at the annual Mayor's Address, State of the City. We're fortunate in our community to have a mayor that is as committed to bringing along those who are less fortunate as he is to accelerating our economy. Among other things, I learned that our London economy has more jobs now than prior to the pandemic, a truly astounding feat, and that we're leading across the province and across the country in terms of job growth more recently. So congratulations to you on a tour de force speech, and thank you for everything you're doing for our community. We have some tremendous numbers on the COVID front over the last couple of days. Just 5 new cases today, just 7 yesterday. Single digits is where we couldn't have dreamed of being even a couple of weeks ago. These are all very encouraging statistics. We hope to continue that downward trend. But the most exciting thing from my perspective as Medical Officer of Health today is the vaccine news. You would have seen in the news release that we were able to produce within the last hour that over the last couple of days, over the weekend, this region saw its 25,000th vaccination. So along with partners, London Health Sciences, Huron-Perth Health Unit, Southwestern Public Health, and the Middlesex-London EMS service, we've now given 25,000 doses. In fact, we're approaching 26,000 doses of vaccines in the Huron-Perth, Southwestern, and Middlesex-London area. About half of those through the Agriplex and about half of those through what we're calling forward deployment, right out in long-term care homes and retirement homes. That campaign in long-term care and retirement homes, high-risk retirement homes, I should specify, will be essentially wrapped up later this week. And then by next week, we'll have low-risk retirement homes receive all of their first doses, as well with second doses within 3 weeks of that. We also have the largest shipment to date that is expected this week of the Pfizer vaccine, which will allow us to expand vaccinations to a whole range of new recipients. Retirement homes, of course, we know are the places that are most at risk. So we'll start with the low-risk retirement homes and other congregate settings for seniors. There will also be expanded eligibility for healthcare providers who are at high risk because of their roles. People, for example, who are involved in intubation of patients where there is an increased risk of exposure to the COVID virus. We'll also be able, in the next couple of weeks, to start expansion into the population of seniors over age 80. That's a big development because we know that group is at highest risk. The group previously had not been included in the phase 1 priorities, but as new data really showed how important it is to vaccinate directly those who are at most at risk, not just their healthcare providers, the province has opened up some of the phase 1 eligibility to include that group. To be very clear, at this point, those over 80 are not eligible for vaccination, but they will become so soon, and we'll have more details for you on that over the next couple of weeks. Dan, I'll pause there. Happy to help take any questions.
Thank you very much, Dr. Mackie. Thank you, Mayor Holder. We do have questions lined up and ready to go, so let's get to those right away. The first question, Dr. Mackie, is from Jennifer Beeman at the London Free Press. Dr. Mackie, are the 8 new cases reported yesterday and the 5 today indicative of disease levels in London Middlesex, or more likely due to the long weekend and test processing?
Yeah, there's definitely a combination of things there, Jennifer. So we wouldn't be seeing numbers this low if the case counts had not declined. But on top of that, you do see less testing done over the weekends, in part because there's less of the long-term care and retirement home worker testing on the weekends, and in part just because there's less attendance at the assessment centers over the weekends. So that's part of why the numbers are so low, but they would not be that low if we hadn't seen a remarkable decline in the community over the last few weeks as well.
Thank you. And Jen has a couple of follow-up questions, and I think these tie to the numbers that you mentioned from the Agriplex, and that we are expecting deliveries. Dr. Mackie, does the health unit have confirmation for vaccine deliveries in the coming weeks? How many weeks of deliveries are confirmed?
So what we have is we have expected allocations over the next couple of weeks. The most recent that we've seen are for this week and next week. All of those allocations come with sort of an asterisk. We don't get confirmation until the week of. So we do have a significant delivery coming this week that is confirmed. And next week, we're hoping for the same as well. Then beyond that, what we have is provincial allocation numbers, which go roughly to the level of vaccine doses we've been receiving about a month ago prior to the shutdown of the European vaccine production facility for retooling. So that brings us back to a number that is, sustainable. It will allow us to make progress, but not enough to really offer broad availability to the general public. So we're still several months away from being able to offer vaccine to everybody who wants it.
Thank you. And Dr. Mackie, you mentioned that we have recently crossed that 25,000 dose threshold. Jennifer Beeman asking again, how many doses will be administered at the Agriplex daily over the coming weeks?
So with the Agriplex restarting last week, we have been able to ramp up to the point where we expect to be able to vaccinate in the range of 1,000 people per day at the Agriplex, sort of by the end of this week and going into next week. That's all dependent, of course, on vaccine supply. That's what we're planning for at the moment, and we'll keep doing so as long as the vaccine supply holds out.
Thank you. Let's move to a couple of questions from Steve Young at CTV. Dr. Mackie, this one is for you as well. It's great news that additional priority groups will receive their vaccines now. How long do you expect that process to take? And how many people on average are in this group who will be needing their first and second dose of vaccine?
Yeah, so so two questions there. First of all, how long will it take? Second of all, how many people in this group? It really depends where you measure the threshold in terms of how many people are in the group. In the very high risk, highest risk and very high risk, I'm not sure if you're looking directly at the provincial framework right now, but together those two groups in this region, Middlesex and London, our estimates are around 15,000 people. And it will certainly take, likely most of the next month to get first doses into arms for all of that group. However, we also need to watch the second dose issue as well. We know that we're getting sort of catch-up doses over the next couple of weeks because of the shutdown of the European facility where we received no doses 2 weeks ago and only a handful of doses last week. So we're getting catch-up doses this week and next week. We will see the number of doses decline. So it's a bit of an art, you might say, in terms of predicting when we'll need those second doses and how many people will be able to vaccinate, how quickly with the doses that are coming into play right now.
Thank you, Dr. Mackie. And Steve has a follow-up, and you touched on this a little bit before with everyone wanting to know when they're going to be eligible for vaccines. Once the group is vaccinated, this is the group we're talking about today who are going to be starting to receive their first doses. What is the next group on the list? When does the MLHU expect the next group to begin receiving vaccines? And does the health unit feel confident that enough of our vulnerable population will receive the COVID-19 vaccine before the predicted third wave comes this spring?
Yeah, it's a great question. What we're seeing is that there is a provincial phased rollout of the vaccine campaign, and those phases are being sort of adjusted, updated as we go. For example, the 80+ group was originally in phase 2. It's now being brought into phase 1, although not at the front of the line yet. And in terms of the next group, so there's a parallel track where vaccine is also being offered to Indigenous adults because of increased risk there, both on reserve and in urban populations. Not exactly clear when that population will become eligible. And then the next large group, so you've got what the province is calling moderate and low risk healthcare workers, which would come into the picture as well in that sort of a phase 2 timing. And then you've also got essential service workers, which to our knowledge have, we haven't seen a definition yet of what essential service workers are beyond healthcare. So we're still looking for provincial guidance on those questions.
Thank you, Dr. Mackie. Let's go to a question from Heather Rivers at the London Free Press. The province has promised voluntary asymptomatic testing in schools. Has any asymptomatic testing started in Middlesex-London schools? And if not, why? Is there a projected date? And should it be a priority, especially with the new variants now in the picture?
Yeah, at this point, we haven't used asymptomatic testing in schools yet, except for all of those students who are in contact with any case. Whenever there's contact with a case, those students are sent for asymptomatic testing, as well as any staff that may have been in contact with that case. But in terms of the provincial new rapid test program that hasn't been utilized here yet, we're just receiving information today that the province will be directing school boards to have a number of schools and a certain subset of their school populations tested on a regular basis. We're still kind of gathering information about what that means. It looks like that direction will go from Ministry of Education to the school boards. And of course, we will support our school board partners however we can to make sure that that happens.
Thank you, Dr. Mackie. Next question comes to us from Jane Sims. Dr. Mackie, now that people over the age of 80 are among phase 1 of the vaccination priorities, how will they be contacted? Are there any plans to get vaccine into the hands of vaccine to seniors in their own homes?
So in terms of communicating with seniors who are over 80, we will have a campaign that identifies appropriate communications channels for that group. That has not yet been defined, primarily because we don't have the openness and eligibility yet. Over the next couple of weeks, as we put that in place, we'll make sure that every possible routes to contact those seniors is being used. At the moment, we don't have a process or timelines yet, or locations, to be frank. So we're working those details out. We'll get them out as soon as possible. The second part of the question was home care workers. Certainly, if we had a vaccine like Moderna that is more flexible than Pfizer, or even the Johnson & Johnson or AstraZeneca, we would be able to do much more in terms of outreach right into people's homes. The issue right now with the Pfizer vaccine that we have access to is the multi-dose vials and the risk of wastage. You've got a vial that contains 5 or 6 doses, and you can't take that vial, to 5 or 6 different houses. Once the vaccine is reconstituted and it melts, you really don't want to transport it unless you have to. And so, you can't really give it to home care workers who are going to be doing one vaccine at a time in each home, because you risk actually degrading the product's effectiveness with each of those subsequent trips. So we'll have to have either a different vaccine or a different strategy to reach those that are in the home care population.
Thank you very much, Dr. Mackie. Let's move down to the next question. There we go. All right, we've got a question from Matthew Trevithick at Global News Radio, AM 980 CFPL. Dr. Mackie, are there any updates on the timeline of the second vaccination clinic in Mount Bridges and the 2 additional clinics that are planned?
Yeah, I appreciate the question, Matthew. We will be opening Mount Bridges within the next week. The exact date is to confirm. We'll let you know as soon as we can on that.
All right.
In terms of additional clinic locations, again, we're going to let you know as soon as we can on those as well.
All right. Moving down, I think there was a question. From Jennifer Beeman that we didn't get to ask. But I think it was very similar to the one we asked about how seniors over 80 would be contacted about vaccination that Jane Sims asked. So I think that brings us to the end of our questions for today. It does. All right, so there we go. A little bit of bouncing around on the questions, but we thank you and we appreciate you asking them. And thank you also to Mayor Holder and Dr. Mackie for your insights, for your information, and for being part of this afternoon's virtual media briefing. We will be back on Thursday this week, back to our regular schedule, 2 p.m. We will see you then for our next virtual media briefing. So between now and Thursday, have a great rest of your afternoon, and we'll see you next time. So long for now.